Kellen first came to see me probably about 2006.
And when it came time to have Parker, she came 2 days before her due date, which was great.
At the very end, she started developing high blood pressure and really got bad after delivery.
And about, I guess, day 2 of her life, they diagnosed me with HELLP syndrome.
It's a variation of severe preeclampsia in most cases and can be pretty dangerous.
I couldn't hold her without another adult being in the room. I couldn't get out of bed. It was pretty crazy.
She did get put on some antihypertensive medications, but then being a healthy person, ended up with no problems afterwards and went into the second pregnancy in a really healthy state as well.
The next time we were able to try, we got pregnant with Layne. I think I found out in September of 2015. And that pregnancy was also very easy.
But around 37 weeks, she just started not feeling very good. And so I had her come into the office.
He just looked at me and said, "Something's not right, let's run your blood work." Because they were making sure, they were following all the stuff to make sure I didn't have HELLP syndrome again. My blood work did come in trending towards HELLP, so he said, you're 37 weeks, we're gonna go ahead and induce you tomorrow. See you at the hospital.
So when we put Kellen on the baby monitor and we're watching Layne's heart rate, initially she looked totally fine without any problems, but soon after, without any intervention for the induction, the heart rate started doing a little more of a rare thing that we don't see very commonly, called a sinusoidal pattern.
Layne was actually losing blood into Kellen's system.
He said, well, this might end up being a situation where we need to do a C-section. How do you feel about that? And I said, I don't feel any way about a C-section. Whatever we need to do, we need to do.
We moved quickly back to the operating room at that point.
They pull Layne out and she is white as a sheet. She's not breathing. So I'm up there by Kellen's head and they bring Layne over to a little table right next to me and they begin CPR on her.
We were able to not have to worry about, can we deliver Kellen safely at this facility and have the baby be somewhere that the baby can be taken care of. Having everything under one roof where each of them can be taken care of at a high level of care and remain together is vital.
I think the fact that Dr. Meckins and Kellen had already a built-in relationship was really helpful in this situation because he knew what to look for in order to check those labs. She knew and had that relationship with him that she could be honest and say, hey, this is concerning to me because of my history.
I think Kellen's story is just illustrative of the very best part of medicine. I mean, she and I are friends. I love talking to her. I love seeing her, keeping up with the kids. Those relationships are why I do what I do, and I'm just honored to be a part of it.
And I know for a fact, and I have chills saying it, that if we would not have been there at that hospital, that she would not have survived. She is a straight miracle. I mean, every single one of them said it. So, this is our little miracle.